If you've had a baby, you might be wondering when or if you should be doing Kegels. So I thought I could bring some light onto that subject today and help clarify it somewhat. Hopefully you've already been to a pelvic floor therapist and you know how to do a Kegel, because many of us don't know how to. About 60% of us aren't actually doing our best Kegel. So hopefully either before you were pregnant or during your pregnancy, you went to a pelvic floor therapist. They've taught you how to do a really good Kegel, and then you can utilize that strategy after you have your baby. So if you've had a grade 1 tear, that's just into the skin tissue. It hasn't gone into the muscle of the pelvic floor. And usually we'll say to clients, you can really start to do some Kegels around that day 3 to day 7. You can do, say, 5 to 10 a day, usually lying down at some point during your day. I know it's hard when you first have a new baby. But lying down and just trying to get a little bit of activation to that muscle again, to start tonifying the muscle, to get some blood flow and to get some movement in those vessels that supply the pelvic floor. And if you had a grade 2 tear, that means you've gone into the muscle of the pelvic floor. And many of us don't know what type of tear we have because we're not told. And those ones take a little bit longer. It may feel more sore to have a pee or a poo, and it can take a little bit more time to rehab after that. So at around that day 7, still you're wanting to do some Kegels, even with a grade 2 tear. It might be just very, very gentle Kegels. Again, I'm assuming that you have gone to a pelvic floor therapist or you know how to do a Kegel, and we want to start rehabbing it. Now remember that some of us don't need to do Kegels. Some of us are hypertonic. And when we have a vaginal delivery, oftentimes that does stretch out our hypertonic pelvic floor somewhat. It does create some opening to that tissue that we still want to keep it closed without going into hypertonicity, into our tight patterns. And if you've had a cesarean, you might not need to do Kegels because maybe you have a tight pelvic floor or maybe you have a normal pelvic floor, and it's all about making sure that your pelvic floor is doing the job it's supposed to without over tightening it. So again, let's go back to our vaginal deliveries and those that have had these tears and want to heal, because our muscles tear when we are having babies. About 30% of us have a macro tear, so which means we're actually tearing those big muscles in the pelvic floor. So we want to make sure that we do rehab that muscle, just like if it is a quad muscle and we have a macro tear, say a grade 1 tear, we call it, in our quad muscle. We don't just stop doing any quad exercise and just leave it be for months at a time. We would completely atrophy our quad. So we do active rehab up to the point where we can get that muscle going again. And the same with the pelvic floor. We can't just ignore it and hope for the best. Sometimes we have to get those Kegels going. So ideally, like once I've got a client up to the state where their pelvic floor is stronger again and they're able to contract, they'll say, well, now I'm good. I don't have to do any more Kegels. But you do. You do have to maintain that strength. And I usually ask my clients if you could do 20 Kegels in a day, whether you do them at the gym and you incorporate them with other exercises, or you do them first thing in the morning, that would be excellent to keep your pelvic floor in a really healthy state as we go through menopause, as we go through our 60s and have some other changes. So we want to make sure that we have a strong pelvic floor that's supporting our organs, that's stopping us from being incontinent, that's strong for when we have intercourse, and we can get that muscle nice and strong too. It gives us more pleasure during intercourse. So it's very important to rehab our pelvic floors. But again, with that caveat that if you have a hypertonic pelvic floor, maybe you don't want to be doing tons of Kegels. You probably have to go in and do the releases first and get the pelvic floor muscle to relax before trying to rehab it and get it strong again. So go to a pelvic floor therapist and see what your pelvic floor is like. But if you've already done that and you're like, oh, should I be doing my Kegels now after having a baby, or should I just let it go and let myself heal for the first 6 weeks? It's a little too long. We want to get you back onto getting your pelvic floor stronger a little earlier so that you're able to manage things like lifting your baby up, because that's part of the core, and the pelvic floor is part of the core. So we want to make sure that you have that strength. So please do some Kegels during that first week. Just try and get that pelvic floor. If it's too painful, either stop and wait a few days. And if it continues to be painful, then go see someone and check to see that there aren't some other problems with stitches, and where their stitches haven't come together properly, or if you feel infection, you get your fever, you can talk to your midwife and your other healthcare providers about that. But according to pelvic floor, let's do some Kegels after we have our baby, and not just forget about them completely, so that we're nice and strong going forward for our next baby or going forward in our years.